Today, we have had 446,601 cases, 2,735 people in the hospital, and sadly, 5,881 who have died. I would make particular mention today of my friend, Mamie Bryant of Gastonia, a kind and wonderful soul who passed away Friday while battling COVID-19. Our thoughts are with her loved ones and all of those who've lost friends or family members. With the holiday season coming upon us, this is a tough time for people worrying about a sick loved one, and especially those who are grieving the loss of someone close. Our prayers are with all of you. There's real hope that we can stop those painful losses. Vaccinations are underway in North Carolina. The first COVID-19 vaccine shipment arrived at 7:20 a.m. yesterday morning at Wake Forest Baptist Hospital. I even talked to North Carolina UPS driver Danny Parson, who made that delivery, which was the first in the country. In addition to the 3 yesterday, 8 more hospitals received shipments today and began vaccinating. 42 hospitals will receive shipments on Thursday. Our North Carolina team spent months preparing for this moment, and now we're moving our vaccination plan into action. Because supply of vaccine is very limited right now, healthcare workers caring for COVID-19 patients, along with the staff and residents of long-term care facilities, are up first. We look forward to more. If the Moderna vaccine is authorized by an independent committee of the FDA on Thursday, we expect to get 175,000 doses of that vaccine next week. Just over half of those will go to long-term care facilities. We expect them to be getting vaccinated at the end of the month. Beyond that, questions remain. North Carolina and every other state still need clarity from the federal government as to how many doses of the Pfizer vaccine we will receive going forward. We've been told that each Friday we'll get information about the following week's shipment, giving the states just a few hours to direct where those shipments will go. Yesterday, I raised this issue with Vice President Mike Pence on a call with other governors. I asked for more time to plan, which is critical as our vaccines roll out across the state, and they said that they'll work on it. Right now, I'd like to ask Dr. Mandy Cohen, our Secretary of the Department of Health and Human Services, to provide an update for us. Dr. Cohen.
Thank you, Governor. I'll start with the good news. As the governor said, the first doses of vaccine have arrived and have been administered in North Carolina. It was a historic and emotional day for many as we finally have a new tool to protect people from this virus. Yesterday, 3 hospitals, Atrium, Duke, and Wake Forest Baptist, began vaccinating their healthcare workers. As a reminder, more than 40,000 people participated in Pfizer's clinical trials. The data showed that the vaccine is nearly 95% effective in preventing COVID-19. And remember, you can't get COVID-19 from the vaccine itself. The vaccine imitates the infection so that our body thinks a germ like the virus is attacking. This creates the antibody defense we need to fight off COVID if and when the real germ attacks. We will continue to have very limited vaccine supplies at first. The best way to fight COVID-19 is to start first with the vaccinations for those at highest risk, reaching more people as the vaccine supply increases. That's why we're starting first with our healthcare workers at highest risk of exposure and our long-term care staff and residents. An effort of this scale, we know, is certainly going to have its bumps. However, the more information we have, the better everyone can plan. As the governor mentioned, we still do not know how much Pfizer vaccine North Carolina is going to receive next week. We've been informed by our federal partners that these quantities will be shared on Friday prior to their shipping on Monday. But I hope the federal government will reconsider that timeline. It's not enough time to allow the state and providers to plan for appropriate allocations or to coordinate vaccine schedules for staff. And while yesterday was a pivotal day, we have so much work to do right now to protect each other and slow the spread of this deadly virus. We are experiencing a staggering increase in our pandemic trends, and I am particularly worried about our hospital capacity. Just 1 month ago, we had 1,395 people in the hospital with COVID-19. Today, we have 2,735 people in the hospital right now. That's twice as many people hospitalized than we had on November 15th. 1 month ago, we had 350 people in the intensive care unit with COVID-19. Today, we have 643 people in the ICU. I know we're all getting so numb to these numbers, so I'm asking you to take a moment to think about who these people are. They're our neighbors, our friends, our family members. They're people we love. Too many North Carolinians are getting seriously ill, and with more than 5,800 deaths, too many are dying. I know no one wants this for our state. Together, we can protect North Carolinians from this pandemic and make sure that our hospitals are able to take care of everyone, whether it's for a broken arm or a heart attack or COVID-19. Keep wearing a mask when you're with anyone who doesn't live with you. Keep waiting 6 feet apart. Keep washing your hands often. These small actions can have big impact, and they save lives. As we head into the holidays, we have a hard ask for everyone in North Carolina. The CDC is recommending that people do not travel and instead stay home this holiday season. If you absolutely must travel or gather with others, it's essential you get tested ahead of time, wear a mask all the time, and keep it small and keep it outdoors. Over the next 2 weeks, we are sponsoring more than 300 free community testing events, including a new partnership with AgriSupply, Carly C., Home Depot, Piggly Wiggly, and Wegmans stores in 7 counties. So go to ncdhhs.gov/testingplace to find a free testing event near you. Let's keep protecting one another. Whatever your reason, get behind the mask. Thank you, Governor.
Thank you, Dr. Cohen, and thanks to you and our team for working hard to prepare for this moment. But the numbers you've laid out are too high, and the vaccine can't yet have a significant effect. We must get these trends turned around. Seeing vaccinations underway gives us hope at the end of a hard year. But this virus continues to be extremely contagious and deadly. We need to persevere and keep using our tried and true safety precautions. Follow the modified stay-at-home order. Care for your neighbors and loved ones by wearing a mask. Keep distance between you and others. The more careful we are now, the more lives we will save. Last week, Dr. Cohen, our Department of Public Safety Secretary Eric Hooks, and I sent a letter to local government officials. We're urging them to help us with enforcement of executive orders to help slow the spread of the virus. Local governments can enforce safety protocols with civil penalties, including fines for violations, instead of criminal charges, which we believe can be more effective. An advisory opinion from the Attorney General's office answers the legal questions. And what we need now is their determination to keep communities safe. Our aim is not to get people in trouble. It's to get people to do the right things to slow the spread of this virus and to keep it from overwhelming our hospital systems. I'm grateful to the many local governments already taking action to keep their communities safe. With the holidays here, I know that it's hard to imagine missing out on our beloved traditions with family and friends getting together. But just like Thanksgiving, we need to rethink what it means to celebrate this December. We're just seeing the Thanksgiving COVID-19 spike over the last few days, and the Christmas holidays could be even worse. The safest option is to connect online or by phone, and if you have to gather in person, try to get tested first, do it outdoors, limit the number of people, and wear a mask. COVID-19 tests are available before the holidays. As Dr. Cohen mentioned, we've worked in partnership with retailers to provide no-cost tests at familiar sites in Buncombe, Durham, Iredell, Lee, Mecklenburg, Wake counties, in addition to existing testing events across the state. And again, you can go to that ncdhhs.gov/testing place website to find out where you can get a test. And remember, a negative test doesn't give you a free pass. It just makes it safer. You'll still need to wear a mask, stay outdoors, practice social distancing in case you contracted the virus after you got tested. These are simple measures that work. Doing them ensures that more of our loved ones will be with us for the next holiday season. With an end in sight, let's come together and work hard these next few months to keep ourselves and our families safe. I know we can do this.